welcome to our Pharma Topics channel. Welcome to the fifth series of BPharm fifth semester portion. The text, the manual or the question and answer pattern preparation for your exams. This video is related to antihyperlipidemic drugs. First one is classify antihyperlipidemic drugs. They are HMG-CoA reductase inhibitors, all the statins, atorvastatin, pravastatin, simvastatin, rosuvastatin, bile acid binding resins, cholestyramine, colestipol, cholesterol absorption inhibitors, ezetimibe, fibric acid derivatives, gemfibrozil, fenofibrate, and other drugs, niacin, lomitapide, and metreleptin. So let us see about statins first and describe the pharmacology of statins. The list is all the statins, atorvastatin, fluvastatin, lovastatin, pitavastatin, and all other simvastatin. Mechanism, this HMG-CoA is an important reductase is an important enzyme for the synthesis of cholesterol in the liver. That is inhibited by these drugs. So kinetics, lovastatin and simvastatin are inactive prodrugs. All other drugs are active drugs. Rosuvastatin is the longest acting and pitavastatin is the most potent statin. Pharmacological actions, in addition to the lipid lowering effects, these statins have some additional benefits such as antioxidant, anti-inflammatory, and anti-proliferative properties. So this collectively called as pleiotropic effects. So that is why every cardiac patient is put on statins. Pravastatin is also causes a decrease in the plasma fibrinogen levels. Therapeutic uses, statins are the first line drugs for type 2A, 2B, and secondary hyperlipoproteinemia. They reduce the risk of stroke and myocardial infarction. Adverse effects, myopathy, that is muscle weakness, and hepatotoxicity. Drug interactions, statins when could be combined with when they are combined with gemfibrozil or niacin, that increases the risk of myopathy. Statins, particularly atorvastatin, lovastatin, simvastatin, are metabolized by CYP3A4. So CYP3A4 inhibitors, they increase the toxicity of statins. Statins when clubbed with warfarin increase the risk of bleeding. Contraindications are pregnancy and lactation. Let us see about fibrates. There are three drugs, gemfibrozil, fenofibrate, and bezafibrate. Mechanism, they activate the lipoprotein lipase through the receptor PPAR alpha. They decrease the TGL and increase the HDL. So kinetics, fenofibrate is a prodrug with the longest half-life. The gemfibrozil and fenofibrate are indicated for the treatment of those who are having very high triglyceride levels, that is greater than 1500 milligram per deciliter, and to prevent pancreatitis when other drugs have failed. They are also used to reduce the risk of coronary heart disease, where there is a triple combination of increased TGL, increased LDL, and low HDL. They are the drug of choice for type 3 and 4 and can be used with statins, that is type 2B. Fenofibrate is a uricosuric agent and it can be used in case of gouty arthritis also. Adverse effects, GI distress, nausea, vomiting, diarrhea, and elevation of hepatic transaminases. Drug interactions, as I already discussed in the previous slide, with statins they increase the risk of myopathy. Bezafibrate does not have this problem. Fibrates with warfarin can increase the bleeding. With oral hypoglycemic agents, it may increase the oral hypoglycemic effects. Bile acid binding resins, they are cholestyramine, colestipol, and colosovelam. Mechanism, they bind to the bile acids in the intestine. They block the enterohepatic cycling of the LDL cholesterol. Since the cycling is blocked, the liver tries to synthesize cholesterol through generation of LDL receptors. They take up the cholesterol from the blood. So this is the mechanism of action of bile acid binding resins. Therapeutic uses, they are used in treatment of hypercholesterolemia and are particularly useful in patients who doesn't tolerate other drugs. The resins are less effective than the statins. They does not cause hepatitis or myopathy. They can be given in combination with other drugs. Bile acid binding resins are used only for type 2A disorders. In this condition, triglyceride levels are normal. The resins also used to treat chronic diarrhea due to bile acid malabsorption. They are effective cholesterol lowering agents in children, pregnancy, and lactation, where the statins are contraindicated. Adverse effects: constipation and fecal impaction. It's about niacin. Actually, it is vitamin B3 or nicotinic acid. Very minute quantities are, um, it is having a vitamin effect, but higher doses are needed for its anti-hyperlipidemic effects. Mechanism: it inhibits a lipoprotein lipase in the adipose tissues, increases it decreases the LDL cholesterol, decreases VLDL cholesterol, decreases lipoprotein A, and also increases HDL cholesterol. Among all the drugs, the maximum HDL increasing is possible with niacin. Therapeutic uses: it is useful in type 2b, 3, and 4 disorders. It also reduces the risk of pancreatitis. Adverse effects: cutaneous flushing, pruritus, which is also common, which could be minimized by pre-treatment with aspirin, GI toxicity, hyperuricemia, and hepatotoxicity. Contraindications: diabetes, it impairs the insulin sensitivity. Ezetimibe, it is an intestinal cholesterol absorption inhibitor. It inhibits a transporter involved in the intestinal absorption of cholesterol, that is NPC1L1. It can be used alone or with combination with statins for type 2A and type 2B hyperlipoproteinemia. The new drugs are lomitapide and mepomerson. These are used to reduce the VLDL cholesterol and the drug of choice for homozygous familial hypercholesterolemia, that is HOFH. So it's a very short information of all the anti-hyperlipidemic drugs which could be useful for your exams. I hope it will be useful. Thank you for listening. Happy learning. Kindly share this to more of your friends. Kindly go through all the series. I will give the link in the description. Thank you for listening. Thank you.